Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CVCT of the patient which you have requested. The area of interest is the upper right and left quadrant and the lower right and left quadrant. Starting with the upper right 4, you can see we've got a class 5 lesion, we've got a grossly carious tooth, and we've got two canals present. If this tooth is to be extracted, we've got an approximate 11 millimeters of ridge width with a good, very healthy 21 millimeters of bone, T3 quality bone, and an immediate implant can be placed. But if this tooth has to be endodontically treated, we've got 16 millimeters of buccal width and 13 millimeters of palatal width. Moving to the upper right 8, the upper right 8 is just BDR with the periapical radiolucency. It's very simple extraction. You can see there's a periapical radiolucency right here. So this tooth has it's not very close to the sinus. It's got good bone underneath. Moving to the upper left segment. So this is the upper left lateral incisor. It's a BDR, which you can very clearly see here. The ridge width is 7 millimeters and the ridge height is 24 millimeters. D3 quality bone, and this also can receive an immediate implant. We've got a infection in the cavity in the canine, cervical lesion as well as the overall lesion. Tooth structure is very weak. So if this tooth is to be saved, post implant will be needed if it needs to be extracted. So we've got 9 millimeters of ridge width with 23 millimeters of height. Just below the apex, the bone goes to 8 millimeters. So that's a buccal depression that needs to be kept in mind when implant placement is being planned. This is the upper left 4. Again, very grossly carious as well. Two canals. If it is extracted, you've got the 2 quality bone underneath, 10 millimeters of ridge width with a good 23 millimeters of height. So here also, and there's also a periapical radiolucency. So if it is extracted, so immediate implant placement is possible. The upper left 7 is also very grossly carious, but this tooth can definitely be saved with endodontic treatment. We've got periapical radiolucencies in the palatal canal, in the mesiobuccal canal right there, and then you've got the distrobuccal canal right here. All three have a periapical infection. Now moving to the lower left 8. The lower left 8 is a horizontal impaction, though two roots are present, but those roots are not very significantly close to the nerve. And periapical infection is present in the mesial root, this would be the mesial root, yes. But it's not in a kind of intimate contact with the nerve. This is the region of the lower left 7. Very good bone here. D2 quality bone. Excellent bone for implant placement. 12 millimeters of ridge width with 12 millimeters of height. Moving to the lower right 5, BTI, present periapical infection, very close to the nerve. 11 millimeters of ridge width with a good 18 millimeters of height. Again, this tooth can be extracted and a implant can be placed immediately. And then we move to the region of the lower right 7. Again, excellent bone here, slight bit of a BTI present. 12 millimeters of width with 13 millimeters of height. The lower right 8 also almost horizontally impacted, but both the roots are significantly far away, as you can see right here from the inferior nerve. This is the axial view. You can see excellent ridge width for implant placement, and you can also see how the 8 on the right side is impacted and how it can easily be extracted, and 8 on the left is also very significantly far from the nerve.